Hey everyone, my name is Manoj Matthew and I'm a body MRI fellow at Stanford University. I will be presenting this month's research blog on GU imaging. I'd like to take this moment to thank all the senior editors for their invaluable help in editing the blog. In this retrospective study, the objective was to use pharmacokinetic modeling parameters for the diagnosis of peripheral zone PIRADS3 lesions in men with subjectively negative DCE. The group evaluated 73 men across 2 institutions with PIRADS3 lesions, who subsequently had targeted biopsy yielding 12 clinically significant prostate cancers, 27 clinically insignificant prostate cancers, and 34 benign lesions. They showed a statistically significant difference in the K-trans and the VE with an AUC of 0.69 for the diagnosis of clinically significant prostate cancers for both parameters. The authors conclude that pharmacokinetic parameters are useful in differentiating clinically significant prostate cancer and outperforms ADC. The objective of this retrospective study was to compare the inter-observer agreement and accuracy of PIRADS 2.0 and 2.1 for the detection of clinically significant prostate cancer in the transition zone among 5 radiologists with varying degrees of clinical experience. 355 patients with transition zone lesions underwent biopsy, with 34 ISUP grade group 1, 59 ISUP grade group 2 or greater, and 262 non-cancerous lesions. Inter-observer agreement was higher for PIRADS 2.1 versus 2.0, with higher pooled AUC for the detection of prostate cancer versus clinically significant prostate cancer. The pooled sensitivity, specificity, and accuracy were also higher in PIRADS 2.1. The authors also found that the reader with the least experience had the lowest sensitivity, specificity, and accuracy, while the reader with the most experience has the highest sensitivity, specificity, and accuracy. The authors concluded that PIRADS 2.1 had a better inter-observer agreement and diagnostic accuracy compared to PIRADS 2.0. However, reader experience continues to impact the diagnostic performance of PIRADS 2.1. This retrospective single-institution study compared the grading of POPQ and MR defecography in 68 patients. They found that MRI has a strong, moderate, and weak correlation with POPQ for anterior, middle, and posterior compartment prolapse, respectively. The authors attributed these findings to inherent differences existing in the MRI technique and the anatomic landmarks between the two methods. The authors suggest that both methods of staging will result in the best patient care. The objective of this study was to compare T2 mapping and DWI to differentiate histologic grades and lymphovascular space invasion in patients with cervical squamous cell carcinoma. They evaluated 58 patients with cervical cancer and compared them to 40 healthy volunteers. They found a statistically significant difference in the T2 and ADC values between the healthy volunteers and the patients with cervical cancer. Poorly differentiated tumors had lower T2 and ADC values compared to the moderately and well-differentiated tumors. T2 values also outperformed ADC in patients with evidence of lymphovascular space invasion. The authors concluded that T2 mapping can serve as a non-invasive biomarker for the histologic grade and the evidence of lymphovascular space invasion in patients with cervical squamous cell carcinoma. The objective of this retrospective study was to evaluate the inter-observer agreement and performance of VIRADS in 91 patients with bladder tumors. After a training session, 5 experienced and 2 inexperienced radiologists used VIRADS to score bladder tumors. 48 patients had muscle-invasive bladder cancer, while 43 had non-muscle invasive bladder cancer. There was moderate to substantial agreement between experienced readers and substantial agreement between inexperienced readers. In conclusion, the authors observed a pooled AUC of 0.87 for all readers with moderate to substantial inter-observer agreement. The objective of this retrospective study was to determine if muscle-invasive bladder cancer could be better differentiated from non-muscle invasive bladder cancer by using volumetric ADC histogram analysis in addition to VIRADS. The authors reviewed 80 patients with pathologically proven bladder cancer who showed a statistically significant difference in the ADC histogram parameters between muscle-invasive bladder cancer and non-muscle invasive bladder cancer, except for the ADC max and the entropy. VIRADS had an AUC of 0.88 with a sensitivity of 88.9% and specificity of 83.6%. The combination of VIRADS and skewness showed the highest AUC of 0.92. The authors concluded that volumetric ADC histogram analysis and VIRADS are both valuable methods, and that ADC histogram analysis can provide value to VIRADS in the differentiation of muscle-invasive and non-muscle invasive bladder cancer. This retrospective study evaluates the usefulness of tadalafil in the visualization of posterior urethra during VCUG and RUG in patients with urethral strictures. The group evaluated 60 men undergoing combined VCUG and RUG, with half of the subjects receiving a single 20 mg dose of tadalafil 2 hours before the procedure, while the other half were in the control group. 90% in the tadalafil group and 40% in the control group were successful in opening bladder outlet on initiation of voiding. There were no serious adverse events, with few patients experiencing mild adverse events. The authors conclude that tadalafil is safe and effectively relaxes the bladder, neck, and the posterior urethra in patients undergoing combined VCUG and RUG for the evaluation of urethral strictures. In this retrospective study, the authors described the urologic manifestations of Erdem-Chester's disease in 24 patients. The authors found that the most common manifestation noted was perirenal infiltration, followed by renal sinus infiltration, proximal ureter involvement, renal artery sheath, hydronephrosis, and adrenal gland involvement. Histiocytic infiltration was frequently bilateral. The authors conclude that kidneys are the most common organs affected by Erdem-Chester's disease, and that imaging can be advantageous with early diagnosis as well as designing a treatment regimen. We also have two wonderful educational articles for the month. The first one is from Radiographics, going over the Bosniak classification of cystic renal masses, version 2019, and a pictorial guide to clinical use. The second article is from the AJR, and it is an update on the role of imaging in clinical staging and restaging of renal cell carcinoma, based on the AJCC 8th edition. Thank you for your attention, and I hope to see you next time for the GU Research blog.